Up here at the Shawville Hospital. Mom's basically got a partially collapsed lung, so it's been going on for a couple of weeks, whatever. Something that the Americans probably don't realize about the Canadian healthcare system. This is some of the drawbacks to the Canadian healthcare system is that you might die waiting for treatment. So yeah, you don't pay out of your pocket and stuff like that. But plus being in Quebec, there's a shortage of doctors, about 1,000 doctors short anyway, because everything's budget based, right? There's no way for doctors to actually bring in new revenue and stuff like that. So there's kind of that kind of catch-22 where yeah, you get the healthcare paid for free, but what you don't get is what you call it, you're on a budget basis. So the more sick people are, the more it's dispersed amongst the people. So that's again, that's what we're dealing with here. So there's good and bad in that. I think a two-tier system would probably, I'm not opposed to the idea, because if the wealthier people, could get private insurance, maybe even pay a little more, yeah, sure, it's kind of unfair in the sense that they get treated sooner, but then again, they don't jam up the hospitals. You know what I'm saying? Like they don't jam it up for the people that don't have as much money. My goal is to have everybody win. But I live in the real world, and I do understand 2 plus 2 don't make 5. There's no such thing as free, even though people think it's free. With the cost of everything going up, holy dust devils! There's dust devils blowing through the. There's a lot of farmland around here, so you get a lot of dust, and I can already smell that spring freshness of manure going out already. But anyway, I just wanted to kind of bring that up. That's what's kind of going on with the hospitals. And I have my sister, for example, she's been waiting almost 1.5 years for, she has a gallbladder problem, stones or whatever she's got to get taken out. You know what I mean? Like, so yeah, it's free, but, for those who would have the money to go and buy more medical insurance or something like that, if they could, kind of get out of the public system so it doesn't jam it up, and how we fund it. Well, there's a lot of things we can cut. For example, we can cut like foreign aid spending, we can cut wars, we can cut, there's a whole bunch of things, Bill 101, all that kind of stuff. We cut the spending on that, put it right into our hospitals. Because really, when it comes down to it, for Canadians, there's usually the number 1 and 2 top priorities for all Canadians is healthcare and retirement. That's, because, I'm a relatively healthy man, but I could slip on a banana peel tomorrow, break my leg, whatever. I could, diseases don't discriminate. Next thing you take a heart attack, or you come down with some sort of a cancer. It happens, and so many people do die in Canada waiting for treatment. It's kind of slightly genocidal, but nobody wants to draw. Everybody wants it free. They want it now, but they don't realize that there's no such thing as free, right? So it's pay me now, pay me later, or insane wait times. So we'll have to, like I say, it's taken 6 weeks from the moment just to get, kind of, the scans and stuff. It's not even, fixing the problem yet. So it takes a long time. So anyway, I guess I'll just leave it at that. It's just something, a bit of an eye opener for people, stuff like that. And of course, my mom smokes like a freaking chimney, and she shouldn't, but, that's what it is. You know what I mean? Like, is the long wait times. So when Americans look at Canada and say, "Oh, look, they have a socialized medicine. It's perfect," and everything like that. Well, it's not perfect. I wouldn't trade it with the Americans for anything, but I think there's definitely tons of room for improvement. Definitely with the wait times, especially here in Quebec. We have Quebec is a really devastated province in a lot of ways. We used to have one of the highest birth rates in the world. Now we have like the lowest birth rate in the world, literally. At least in the country anyway. We lost, from the making of this video, last month 20,000 people basically pretty much lost their jobs, 6,000 of which were in healthcare and education. I'd be making cuts to the education system before the healthcare system, because it's, do or die, the life, stuff like that. But that's the thing, and then we spend it on things that are just completely senseless, like Bill 101 or governor generals, the Senate, paying all this money to the Queen, just to say we know her, stuff like that. That's, and then of course, we ship all our jobs overseas, okay, which takes revenue out of the country, and then everybody's underemployed. So now you have a tax base that is just devastated, and then of course, you get austerity. Basically, most people don't understand what austerity is, and that's the prolonged wait times at the hospital. That's austerity. And you don't see it right away. And that's the thing. People don't see it right away. So what it really comes down to is, yes, there isn't enough money for a good healthcare system in Canada, but we need to prioritize what we spend our money on. You know. So, and it's not just in Quebec. This is all across Canada and everywhere in the world. It's all about priorities. And government needs to kind of realize that. Okay, well, if it requires experimenting with the public versus private system a little bit, that might not be a bad idea. Look at a dentist. You book, you got a bad tooth. If you got the money, bang, you can get seen right away. So what I'm saying is this: okay, for the people that don't have the money, have the public system that are under, say, a certain wage or whatever, or a certain income earning. Sure, but for the people that can afford it, if they can get immediate service, good for them, and it doesn't jam up the public system. So unfortunately, nonprofit ends up costing us more than a profit system. So it's kind of one of those kind of catch-22s. But anyway, I guess I'm babbling now. So anyway, rate, subscribe, share, comment, like. There we go. Okay, hi and welcome. All right, so I'm just up here at the Shawville Hospital. Mom's basically got a partially collapsed lung, so it's been going on for a couple of weeks, or whatever. Something that the Americans probably don't realize about the Canadian healthcare system. This is some of the drawbacks to the Canadian healthcare system, is that you might die waiting for treatment. So yeah, you don't pay out of your pocket and stuff like that. But plus being in Quebec, there's a shortage of doctors, about 1,000 doctors short anyway, because everything's budget based, right? There's no way for doctors to actually bring in new revenue and stuff like that. So it's kind of that kind of catch-22 where yeah, you get the healthcare paid for free, but what you don't get is you're on a budget basis. So the more sick people are, the more it's dispersed